Hey Joe, got a bit of a potato quality signal, so I thought it'd be easier to give you a video than call you. So, verrucas, if I explain everything about them, then you can make an informed decision on how you want to treat them because there are significant choices to be made. So, a verruca is a viral infection, as you know. It is HPV 1, 2, 4, 27, 57, none of which can turn malignant. Some HPV strains can turn malignant, verrucas can't. So I'll throw that out there just in case you start thinking, oh, hang on, HPV, that's cervical cancer territory. It's a completely different virus. It's entirely benign. It cannot go nasty. It is part of your normal skin flora for the vast majority of people. The HPV virus is everywhere. It is on every door handle, in every public transport handrail. You cannot avoid the virus. It is like staph and strep and all of the other things which you find everywhere. So don't worry about trying to sterilise your shoes. The virus was there before, it will be there afterwards. You can't avoid it. It only causes a growth, it only causes a verruca when it penetrates to the basal layer, which is the junction just between, you've got the living bit of the skin and the dead bit of the skin, more or less, the dermis and the epidermis. It's the layer between the dermis and the epidermis where the skin is actually produced, where the cells that slough off and die are produced. So technically it's kind of outside of the body. It does the usual viral thing, which is that the virus gets into the cell, changes the cell's DNA, and makes lots of copies of itself. But that's where it differs. A normal virus, what it will do is it will get into a cell, replicate itself, cause the cell to burst, releases the viruses into the environment where they find other cells, break in, so on and so forth. The way your immune system works is by looking for these viral cytokines as they're floating around, sampling them, and makes an antibody for that specific thing. So what happens is when you get a cold, for example, you get sick, you get more and more and more and more viral cytokines, then your body actually gets hold of it, starts producing antibodies, and then it kills them quicker than they reproduce. The verruca, however, is a clever little ninja bastard, and it basically hides. What it does is it does invade the cell, it does change the DNA, but it doesn't cause the cell to rupture. Which means that although it will change those skin cells, so the skin that it produces is weird skin, which is what you actually see, that's the mass, it doesn't release viral cytokines into the body, which means that the immune system does not see it, which means that the immune system does not know it's there, which means the immune system does not kill it. Which is why they are such unconscionable little shits to get rid of. The incubation is about 3 to 8 months, so you probably picked it up 6 months ago, thereabouts, never even knew you had. So, all of the treatments for verrucas, there are none which target the virus directly. We cannot kill that virus in the same way as that we cannot kill the common cold. So all of the treatments, the way they work is by damaging the cells that the virus is living in, preferably causing those cells to rupture, to release those viral cytokines into the skin, and hopefully that increases the chances of an antibody spotting it. As soon as that happens, your body will actually create antibodies and get rid of the infection, get rid of the virus, the verruca will heal, will go away. So all of the treatments we have are designed to basically ring the alarm bell, alert the body to the fact that there's a problem. Because of that, they're all just a little bit shit. Lowest end of the spectrum, you have, so there's basically a therapeutic ladder, there's choices that you have. Lowest end of the spectrum is just ignore it, just don't even worry about it. That's not a terrible idea, I'll be honest. If it's not causing you any pain, they are self-limiting. Sooner or later, the immune system will spot it just through blind luck. So there is a lot to be said for just leaving it alone. If it's not hurting you, don't do anything destructive to yourself that's going to cause yourself pain to get rid of something that isn't a problem in the first place. So possibility one, just ignore it. Possibility two is to use occlusion. So you would use tape. You mentioned zinc oxide tape. That's absolutely perfect. Just cut a little square of tape, sort of centimetre square, and just keep that stuck over the thing. When it starts to get a bit manky, just peel it off. Little bit of alcohol over the area to dry the skin, another layer straight on, and just keep repeating that. Keep it covered up all the time. What that does is it stops the cells in the skin there from losing moisture, so it stops the skin from hardening, usually stops it being painful. It doesn't particularly improve the chances of it resolving, but it will keep it comfortable and it will reduce any risk, it will obviate any risk of it spreading or getting bigger or anything like that. And that has the advantage, it causes no pain and involves no risk. Then you've got the over-the-counter caustics. This is your bazookas, your Salactols, your pickles, that sort of thing. They're acids. They work by causing an acid burn. And an acid burn obviously causes inflammation. Inflammation means more red blood cells, which means more white blood cells, higher chance of it resolving. The concentration is important. 10% is fairly low grade, up to about 40-50%, which is really, really serious stuff. You can do real harm with caustics. The stuff never stays where you want it. So what you tend to end up with is a small inoffensive verruca sitting in the middle of a fucking great chemical burn, which is a lot more painful and troublesome than the verruca was in the first place. Success rate for those is between 30 and 50% for 3 months application. So in other words, you have that on all the time for 3 whole months. You've got at best a 50% chance of it working, which is not great. Personally, I don't like those options because they guarantee pain and they don't guarantee anything else. The chances of it working are relatively low. If you are going to do that, though, there are ways of sort of trying to make sure it does stay in the right place. So if that's what you decide to do, let me know. I can talk you through that. Corn plasters, the reason that we all freak out about those is because they're horrible things. They're usually 40% acid, which is very strong, and they're always bigger than the lesion, which means that you do just end up with a verruca or a corn sat in the middle of a chemical burn, which it's painful. It's not nice. Freezing is more or less the same in terms of success rate, except that you only do it every sort of week or every month. Again, the success rate hovers around 50% depending on which study you read. Freezing has the advantage that it is a short-term single insult to the tissue. So this is a thermal burn. So it has the advantage that it's controlled. Disadvantage, it's more immediately painful, and for the first 24-48 hours. If it's not painful, it's not doing anything. If it's not causing pain, it's not getting enough depth or reduction in temperature with the freeze to cause a burn, to cause the inflammation, to get rid of it. The professional freezing kits, the stuff that you get done at a podiatrist, is somewhat better. And if you're going for a non-surgical treatment but wanted something a bit more aggressive, that's probably where I would go. But again, you're not talking high success rates at all. Above that, you're in the realms of surgical treatments, the best of which is something called needling, which is done under local anaesthetic. The local anaesthetic is not at all painful. Ankle blocks, tibial blocks are not at all painful. So you numb the foot, and then you basically just get an empty hypodermic needle and you pepper the verruca. And what you're doing there is pushing the viral cytokines into the body where the immune system can get hold of them. Advantages are that it has the close to the highest success rate, which would be 70%, 60-70%, based on 3 treatments. The treatments themselves are not painful like freezing is if it's done properly. The damage to the tissue is very tightly controlled, so you don't have the problems that you have with caustics of a bigger burn than you want, more damage than you want. It's probably what I would do if I was going to try and get rid of one. And that's something that I'm quite sure Tori could do for you if that's what you wanted to do. My advice for what it's worth is if it's not painful, personally, I would just leave it well enough alone. It's not hurting you. Any kind of treatment you do will hurt it, will hurt you. It will cause pain. The verruca is not causing pain. There is a limit to the wisdom of causing pain to get rid of something that isn't. It's like burning down your house to get rid of a cockroach. So my advice would be either do nothing or just do the zinc oxide tape. But if you were going to treat it, then if it was me, I would go hard and do the needling. It's go one extreme or the other. As I say, the over-the-counter caustics, they're messy, they're hard to control, and they generally cause more pain than they avoid. So have a mull on that basis and then let us know, and whichever one you wish to do, we can talk you through the best way to do it and the best chemicals to use if you want to use chemicals, best place to get the surgery done if you want to get the surgery done, or none at all if that's what you prefer. Okay, hope that helps.